Imagine how difficult and taxing it must be to train to become an Olympic athlete. Now, even more, imagine doing that with a medical condition that causes lightheadedness, dizziness, ongoing fatigue, spikes in heart rate, and drops in blood pressure. We recently learned that Katie Ledecky, one of America's most rewarded athletes at the Olympics, suffers from a condition called POTS. Now, there's a lot that we can do for this to help our patients out, so let's talk about it. Hey everybody, it's Dr. David. I'm a board-certified pediatrician and functional medicine doctor in the Tampa Bay area. I've been working with patients with POTS for many years now, and I was one of the first pediatricians to recognize that this could be an issue in adolescents, and especially in adolescent females. So let's talk about this. Now, POTS stands for postural orthostatic tachycardia syndrome. Postural, that means change in position. Orthostatic means to standing. Tachycardia, high heart rate. Syndrome means a cluster of symptoms that put together to define a syndrome. Now, Katie Ledecky, she is the GOAT, the greatest Olympic athlete, the greatest American in terms of winning Olympic medals. She had 14 medals total, 9 gold, 4 silver, and 1 bronze. She won her first Olympics at the age of 15, her first gold medal, her first time in, she won a gold at 15 years old. And that's such an amazing thing. It's like something that we've all been cheering her on for many years. And now she let us know that she suffers from POTS. So let's talk about this more. Now, POTS itself, it is defined mainly by this change in heart rate. Although I mentioned some of those other symptoms, it's really a change in heart rate that makes the diagnosis. What one does is they check people's vital signs, their heart rate, their blood pressure, when they're laying down, after about 5 minutes or so. Then you stand them up. Then you check their blood pressure again, some people at 5 minutes, 10 minutes, but if there is a jump in heart rate of 30 beats per minute in an adult, 40 beats per minute in an adolescent, that is the diagnosis. That gives it to you. Now, there could be other things that cause it too as well, so obviously you have to rule some other things out. But orthostatic hypotension, the drop in blood pressure, that's not actually part of the diagnosis, although it is something that is commonly seen and, of course, can make people feel pretty bad. Now, what's happening here is that there could be other symptoms like lightheadedness, and you could faint, brain fog, heart palpitations, not just the fast heart rate, nausea, vomiting, headaches, excessive sweating, shakiness, exercise intolerance, and one of the things, we don't know for sure why this is happening, but there are some things that we do now know. We do know that the blood pools below the heart. So especially when a person stands up and with gravity, it'll go down usually into the legs, but also that means if there's more blood down below the heart, there's less blood to pump to the brain. And that's where a lot of these symptoms end up coming into play. Now, when there is this lower blood pressure, this drop in this pooling and not enough blood flow to the heart, our body then instantaneously will release epinephrine and norepinephrine. And these cause the heart rate to go up. And this is why it's referred to as a dysautonomia. Autonomic nervous system, the sympathetic, parasympathetic nervous system, is what takes care of many things in our body, like our heart rate and our blood pressure and how we breathe and all of those things. But now there's mounting evidence that there's an autoimmune component. So between 89 to 100% of patients who have the diagnosis of POTS have been found to have an autoantibody that's elevated against the G protein coupled the adrenergic A1 receptor. So adrenaline, that kind of comes from the same place. The adrenergic system, adrenal glands, cortisol. So there are these antibodies, though, that are blocking that receptor. Also, 55% of patients were found to have elevated muscarinic acetylcholine M4 receptor autoantibodies, and acetylcholine, again, another part of the autonomic nervous system. So now, what is it that we do to treat? Now, before we even go that, I do have to warn all my teenagers and adults who have this condition, do not drink alcohol. It makes it worse. causes vasodilatation, causes the blood vessels to open more, allowing for more pooling when we want to vasoconstrict, tighten up the blood vessels. The most important thing to be doing right off of the bat is making sure that adequate, if not overdoing, hydration. A patient with POTS should be drinking at least 70 to 100 ounces of fluid, sometimes even more. In addition to, though, they need sodium. 3,000 to 10,000 milligrams of sodium a day, which is way, way more than a person would normally get in a diet. Now, of course, electrolyte drinks are one of the best ways of accomplishing that. And you'll see electrolyte drinks that have anywhere between 300 to 1,000 milligrams of sodium in one packet. Now, you do have to watch for the sugar content. Some of them can have way too much sugar, but you also probably want to have some sugar there, not just a keto type of hydration, because carbohydrates, sugar, glucose in particular, and salt are needed to optimally absorb fluid across the intestinal lining. Now, some people may even need to get IV infusions with saline. Now, one of my patients who recently graduated from high school, and this is a diagnosis that we've been dealing with. It's been a struggle for her to get fluids and salts into her. And she was coming up on graduation, and she really didn't even know whether she'd be able to walk to go to graduation to be able to enjoy it. And so despite her needle phobia, she decided to come in and get an infusion right before graduation. So then her mom sent me pictures of her happily, she was wheelchair bound, rolling across the stage, getting her diploma, everybody cheering her on, the look she had on her face, the accomplishments, bright young woman. And just to see this and her mom telling me that she enjoyed her graduation. She wasn't enjoying very much a part of her life at that point. And just to be able to give her that one day. And since then, we've done a few more, and she's getting better. She's enjoying life. She's going to the beach. She's doing things that were memories for her, and she's doing it now. So that can be really, really helpful. Now, other things that we do is to try to reduce autoimmune potential, reduce hyperinflammation. How do we do that? By optimizing the microbiome. Doing tests of the stool, checking to see how the levels of the good flora are, and are there any pathogens growing that could potentially cause inflammation. Avoiding inflammatory foods, ultra-processed food, processed deli meats. Look at an anti-inflammatory diet. That can be very helpful because, again, if there's too much inflammation, we don't want to do anything to make more inflammation. Optimizing certain nutrients like vitamin D and zinc. I've been talking on this channel forever of how that controls inflammation, but it's not an immunosuppressant like a steroid would be over time. Now, also optimizing methylation. Do you have MTHFR, MTRR mutations? Do you need methyl forms of B12 and folate? Other types of glutathione, giving that sometimes intravenously as well. The master anti-inflammatory antioxidant of the body detoxifier. There's also other supplements, curcumin. Other types of flavonoids, they reduce inflammation, including neuroinflammation. And cannabinoids, THC, CBD, CBG, CBGA, they all have anti-inflammatory properties. Now, another important thing, especially because a lot of people are not really physically active, but they need to be. They need to be working with a physical therapist, going very low, very slow. It can't just jump right in, but they need to get back active. They need to get the blood flowing better. It's good for our mental health as well. Aquatic exercises in the pool, swimming laps, water resistance exercises with gloves, those can be really good. And also, most people, even people with fatigue and other symptoms, do well in the pool. Now, there are also many patients who do have anxiety and depression. And so having a mental health therapist, a counselor, to help them work through that on the mental health side while we're dealing with the physical side, that can be really important. Now, there are medications out there such as beta blockers, which block the epinephrine and norepinephrine. Fludrocortisone, which is a type of steroid that increases salt retention. It increases blood volume. Pyridostigmine. Let's get that right. Pyridostigmine. It may reduce tachycardia, lowers that heart rate. And midodrine, and that causes widespread vasoconstriction, again, the constriction of those blood vessels. Now, my take overall, don't blow this off. Physicians, healthcare providers, listen to what people are saying. Take more detailed history. You have to ask these types of questions or you won't be able to make the diagnosis. Now, you need to also be aggressive. These are people who are suffering and suffering bad. See at least what fluids and the electrolytes will do. That can make a big difference in most patients. Some don't need anything more than that. And also, yay, Katie. Yay to the rest of the Olympians, everyone who won medals out there, people who even made it out there to France. My gosh, you're amongst the elite of the elite. And we honor you and thank you for allowing us to have our national spirit and to allowing us to cheer you on. Have a great day.